Okay. Good morning, everybody. So good morning, right?
Good morning.
What happened yesterday?
We don't want to talk about it.
The Cowboys won.
Oh, okay. Well, let's start on the first page of the booklet then. Just open up your booklet. The first page, of course, is just a table of contents. We'll go through everything. Page 2 or 3 is the products we'll go over with you today, the medical coverage with the health savings account and plan without, dental coverage, vision, the life insurance. So turn with me to page 4, and this is just a benefits overview page which says this is annual enrollment. This is the time that you have the right to make changes to your insurance coverages. You can drop coverage, add coverage, enroll for the first time. Anything you enroll for the day, whether if it's new or a change, that will be effective January 1st, 2020, okay? So if you got current coverage that stays through December of this year, the new coverage starts 1/1/2020. Again, at annual enrollment, you have the right to make changes to your coverage, so you can drop or add whatever you want to do. Other than that, if you need to make any changes in the future, you can only do it if you have one of those qualifying events, which is not all the qualifying events, but the major ones. If you get married, divorced, or legal separation, get a new dependent. Anytime you have a qualifying event under Section 125 of the IRS, you have the right to make changes to your medical plan, dental plan, and vision plan. Any questions? Trying to think that's loud enough. On the next page is just the guidelines for membership in any of the coverages, and for yourself as an employee working at least 30 hours per week is eligible for coverage. Dependent, your spouse can be added, and children can be added, and children are covered all the way to age 26. Even if they get married before then, if you want to continue on your policy, you can. All your children are covered to age 26. Any questions on that part? Next page is Next page is the medical plan. Very good news there. Again, there is no change to the benefits. There's no change in the cost to you. There was a rate increase by Blue Cross, and your employer, John & John, has decided to absorb the entire rate increase. So make sure you thank that young man, young men, whatever. That's kind of like a pay raise, because there's no cost is being passed on to you, the employee, for whatever tier of coverage that you have. Your rates will stay exactly the same. And I think this is be the third year, Jonathan, is that correct? No rate change to the employees? Yeah. So the company's been absorbing whatever rate increase there has been. How long they can do that, I don't know. It's up to you guys. Keep generating that revenue and make them happy, and you may never see a rate increase.
Third year with no increase, fourth year with the same rates.
Yeah. So let's go over the two plans. On the left-hand side of the page is what's called the copay plan, the PPO copay plan. And the right side of the page is the Blue Saver plan, which is the high deductible health plan. So I'll run through kind of a comparison as we go through it. On the copay plan, you have a $2,000 deductible, and I'll just do single. If you got families, the numbers are right underneath there. On the Blue Saver, the high deductible health plan is $3,300. Your max out of pocket for an individual is the same for both plans, $6,250. What does that mean? If any person hits the maximum amount of pocket for the rest of the year, Blue Cross picks up all the expenses 100%. Okay? The co-insurance is 70%. What that means is once you meet your deductible, I'm just gonna stay on the PPO plan because the high is a little bit different. So I'm gonna jump off of it. Once you hit your 2,000 deductible, Blue Cross will pay 70% of the cost, of the discounted cost. You'll be responsible for 30%, again, till you hit your maximum out of pocket of $62.50. Any preventive services covered at 100%. You go ahead and have your well woman exam or well man exam. You don't even pay a copay, okay? It's covered at 100% for any of the wellnesses. When you have a doctor visit, primary care doctor visit, it's a $40 copay. That's all you pay. The balance is covered by Blue Cross. Co-insurance doesn't apply, deductible doesn't apply, okay? It's just nothing but a copay on that doctor visit. Specialist visit is $55 copay. Urgent care, $55 copay. Emergency room, the deductible would apply first to emergency room, and then your co-insurance after that. So if you got something kind of urgent, you might want to try to use an urgent care facility. Now if it's chest pains, yeah, you want to go to the emergency room, but if you can use any of the urgent care centers, you're only going to pay a copay. If you go to the ER, you're going to have to meet that $2,000 first before anything's covered, and then you'll pay 30% over that balance. So try to use urgent care facilities if at all possible. Inpatient is the same deductible than co-insurance, and outpatient facilities is the same deductible than co-insurance. Prescription drugs, that's no deductible. You remember we removed that off of your plan several years ago, and so that was a big added benefit. You don't have a deductible there. Tier 1 drugs is a $7 copay, Tier 2 is a $30 copay, and Tier 3 is a $70 copay. Any questions on the PPO? We're good. Now I'll move over to the Blue Saver plan. It is, again, the high deductible health plan. Your deductible is $3,300 for single, $6,600 if you have family coverage. Your out-of-pocket is $6,350 for single coverage and $12,700 for family coverage. Once you hit your deductible, Blue Cross, same as the other plan, will pay 70%. You pay 30% until you hit your out-of-pocket limit. Now, one of the big differences between the two plans is on the family deductible and out-of-pocket, okay? When you enroll in the higher plan, if you have family coverage, which is just a spouse or just a child, or a spouse and a child and a spouse and 10 children, it doesn't matter. You have to meet that family deductible and that family out-of-pocket. So if you had more than one person covered, the PPO, each person has a $2,000 deductible up to 3 people, okay? So if you're on the PPO, once you hit the 2,000, the plan pays 70% on you. Your wife hits 2,000, pays 70% on her. On the Blue Saver plan, if you have family coverage, any type of family coverage, you have to meet the family deductible first and family out-of-pocket limit before it's 100%. Once you hit that deductible, whether single or family is 2 or more on the high plan. Then Blue Cross pays 70%, you pay 30%. That includes prescription drugs. So the high plan is pretty simple. You got a deductible and out-of-pocket, and once you hit one of those, it either goes to 70% after the deductible, 100% once you hit the out-of-pocket limit. So both plans pretty much, it works a little different, but you got the same out-of-pocket limits. And on the next page right below there, if you got the book open, flipped open, is your premiums. As you can see, you was paying, if you got single coverage for the PPO plan, it's $135. Is your payroll deduction amount, it's staying at $135. If If you had family, $325, $325. No change. The same thing on the high plan. It is $70 currently, and it's gonna stay at $70, and $155 for family. So, with that said, on the next page, tied to the high deductible health plan is, oh, it's not on the next page. Well, flip with me right quick to page 11. With the high plan, you can have what's called a health savings account, okay? So you can put money in this health savings account pre-tax to go along to provide the amount of money that you need to pay for your health care up to your deductible, up to certain limits. If you have single coverage, the max you can put in is at the bottom of that page is $35.50. Family coverage, you can put in $7,100. If you're 55 or older, you can put up to another $1,000 in the health savings account, whether it's single or family. So I want to encourage you, if you enroll in the high plan, at least put some money into that health savings account, so when you have health care, or you can, I always tell employees, you can take the difference between the two, which is $65 a paycheck. At least if you roll in the high plan, assume that you're in the PPO plan, and at least put that amount of money a paycheck into the health savings account. And over a year's time, you'll have a good bit of money in that account to pay for your, some small stuff anyway. But the purpose of the health savings account is to accumulate money over the years where you can totally fund your deductible and your out-of-pocket limit. Remember that money goes in pre-tax. Everybody remember how pre-tax work? Every dollar you put in pre-tax, you don't pay the state tax, federal tax, or the FICA tax. The FICA tax is Social Security, Medicare, okay? That's at least 20 cents on the dollar that you save, or it's like the government puts that money up for you, because you would have had to pay, if you didn't pre-tax that amount of money, you would have had to pay taxes on that money. So it's like the government helps you fund your health savings account, help you fund your deductible by allowing you to have that money come out of your paycheck pre-tax. We good there? Okay, we'll back up to page 8. That's the changes that Blue Cross made to their plans. You can read those. I'm not gonna go into detail, but I know, Kevin, you had some interest in telehealth benefit last year. So it's being expanded now to include all the following services that you can do by phone, by your cell phone, or video, or just chat, just dial and talk to someone, and they can diagnose and perhaps prescribe you whatever's needed for that condition. It's a lot of the minor things, nothing very serious, but. And then you can see the other changes that's being made to the medical plan. And on the next page is based on the Affordable Care Act, the changes to the non-SA, HSA qualified plans and HSA qualified plans. And you can see your maximum there. Any questions there? I hate to flip like that, but page 12, we'll be on the dental plan now. We did get a rate increase on the dental plan, so we went to the marketplace and checked with various carriers. We did find a plan that was even lower in cost, even though you was getting a rate adjustment on the current one. It's lower than your current rates. The benefits match up identical to what you had before. Now there will be a change in the network, so you'll need to check the network. The benefit is a $50 calendar year deductible per participant, with a maximum benefit of $1,000 a year. Diagnostic and preventive care, again, on the dental plan is covered at 100%. So just like your medical plan, both medical plans cover preventive 100%, whether you're on the PPO or the high deductible health plan. So you can also have your dental covered 100%, deductible does not apply. The deductible will apply to basic services, major services, but not preventive services, okay? And you can see down there, you were paying, if you had single coverage, you was paying $12.38 a paycheck. That's dropping down to $11.81. And for family, you were paying $35.57. And again, these rates was going up a little bit. And now you will pay $33.92. So you're getting a rate reduction there. Any questions on the dental plan?
So they will no longer show their Blue Cross card when they go to the dentist or vision, because I see your principal will not issue an ID card.
None of the carriers actually issue ID cards. We can get you a card if you really need one. But all the dental offices know. I mean, if you check the network, you go there and you just tell them you're with principal, they're gonna go in there and check to make sure you are with principal and what's your benefits. So a card doesn't do anything for you on dental insurance, other than show that you have dental insurance. The providers are gonna always check. Even if you're just going in there for basics, cleaning and stuff like that, they're gonna check all that when you make that appointment. So just tell them you're with principal. And you can go online to principal, which we give you their web address when we list all the carriers out. And you can check, now Roberta, I know you checked, and right here in Crowley is, you remember?
Well, for the vision, they do accept Walmart, the vision.
Yeah, but on the dental.
The dental, there wasn't any providers in Crowley.
What was the one you were talking with Tran about?
Petrie's in Jennings.
Oh, that's in Jennings.
Jennings, yeah.
Okay.
But there were plenty places in Lafayette. I think there was a place in Rain, somebody in Rain.
Yeah.
And it's very easy to go look it up.
Yeah, just go to principal.com and select providers, and it'll give you that. Next page is the vision. It's with principal also. And you're gonna see that your cost goes down on that plan also. The rates will reduce for you. Of course, if you have employee-only coverage, again, John & John pays that cost 100%, so it doesn't cost you anything. If you have a spouse, you were paying $1.90, it's now $1.65. If you had children, if you were paying $2.85, it's now $2.47. And if you have family, you were paying $4.11, it will now be $3.58. So this is a good year. We've got good news. I mean, rates on a couple plans are going down, and the biggest rate is not changing, and your benefits are not changing. That's good news in today's world of insurance, let me tell you. Very good news. Right, Jonathan?
Correct.
Next page is the life insurance. If you enrolled in the medical plan, John & John also provides you with $25,000 of life insurance, $25,000 accidental death insurance, which means if you died accidentally, it would pay a total of $50,000. Any questions on the benefits? Okay, next is how to enroll. Roberta gave you a sheet with your elections currently. All we need you to do is sign that sheet and date it, unless you're making some changes. If you're making some changes, there's an additional form. You will have to sign, and we'll hand those out to you. Anybody making any changes, if you want to add a spouse, drop a spouse, stuff like that, and then we'll get you enrolled in the system. And again, if you're not currently enrolled in anything, there will be a form, that same form, just like a change. for you to complete. And the rest of the pages are just notices required by law to disclose to you. You can read them tonight when you get home so you can fall asleep. Any more questions? Okay. Thank you.